Hey guys, in this video I'm going to talk about the blood vessels and how the blood pressure regulation is happening and various kind of factors that are affecting the blood pressure and how it is regulated. So let's see. So first, the classification of vessels. So mainly we know that in our body it is artery, then capillary, then veins. So artery is going to supply the blood to all the tissue, that is oxygenated blood. Then the via capillary, this tissue will obtain the all the nutrition and oxygen and remove the toxic material and carbon dioxide again, and then this deoxygenated blood will go to the veins. So artery, capillary and veins. Artery is again divided into elastic and resistance vessel. So elastic vessels and resistance, and if you see from the histology, we will learn in the pathology actually that arteries are of two types, elastic artery and muscular artery. So this elastic is elastic and the resistance ones is actually the muscular artery, that are arterioles. Now capillaries are known as exchange vessel, as we have learned that they are going to supply the nutrition and oxygen to the tissue and take up the carbon dioxide and waste material that are accumulating by the metabolic process. Now the veins are capacitance, means they are going to store the blood, and actually 1/3 of the blood is going to be stored in this veins actually. Now elastic vessels. So elastic vessels, the main example is aorta, and due to this Wind-Castle effect. So what is Wind-Castle effect? It is a property of elastic recoil still in the blood vessel, such as the aorta, which squeezes the blood and pushes it forward during the circulation. So from this you can understand the concept of systolic blood pressure and diastolic blood pressure. So let's see. So systolic blood pressure and diastolic blood pressure. First let's talk about what is blood pressure. So blood pressure is the pressure, means what is pressure? Forced upon area. So around this blood vessels, the force that is applied by the column of blood to the unit area of the vessels is known as the blood pressure. And if you can imagine, you can see that this blood pressure is going to directly proportional to the column of blood, I mean the volume of the column of blood. So higher the volume, the more will be the force. So this systolic blood pressure and diastolic blood pressure. So the systolic blood pressure is actually the heart pumping, through the cardiac output. We know that cardiac output is a stroke into heart rate. So in 1 minute, the amount of blood that is going to pumped by the heart is cardiac output. So this cardiac output, if you multiply the cardiac output with peripheral resistance, you are going to find the blood pressure. So this is the formula of actually the blood pressure. So cardiac output into the peripheral vascular resistance. Now this systolic blood pressure is going to depend mainly upon the volume of blood. So these two type of blood pressure, systolic and diastolic. Systolic is, we know that the highest pressure that is recording during the systolic part of the heart, means heart is contracting in pushing the blood, that is we know a cardiac output. So the maximum amount of pressure that is recording during this part is known as systolic blood pressure. So it is obviously going to depend upon the volume of blood. And second, the diastolic blood pressure. So here this Wind-Castle effect will come into the picture. So diastolic blood pressure is due to this elasticity of aorta. So what will happen during the systolic part, the cardiac output, means the volume of blood will apply the pressure to the blood vessel, that is, and the maximum pressure is known as systolic blood pressure. Now During diastolic part, this elastic vessel, what will happen, elastic recoil will be seen. So first during systolic part the vessel will dilate, not dilate, but due to elasticity somewhat it get you can imagine that it gets stretched somewhat. So now during this diastolic part it has to be recoiled back to this original position. So due to this recoil it will push the amount of blood, and that's why this diastolic blood pressure will be there. So diastolic blood pressure is going to be proportional to this elastic recoil plus total peripheral resistance. So now this total peripheral resistance will be depend upon whether the vessel is contracted or dilated. So if the vessels are contracted, the peripheral resistance will be more and the blood pressure, diastolic blood pressure will increase. And if the peripheral blood vessels are dilated, then the diastolic blood pressure will be low. So this directly depend upon the total peripheral resistance. Okay, and this depend upon if the whether it is contracted or dilated. And the second thing is the elasticity. So if the vessels are very hard, as we see as we age, vessels are going to be hard by the calcium deposition and all the changes, senile changes that is happening, then this blood pressure is going to be increased. So if any drug that is going to dilate or contract the blood vessel, mainly it is done by the sympathetic outflow, because sympathetic outflow is responsible for the contraction and dilatation. So mainly sympathetic outflow is going to determine the diastolic blood pressure. If we give alpha receptor agonist, what will happen, it is going to contract the blood vessels, especially the alpha 1. Alpha 2 is presynaptic, so if you give the alpha 2 receptor, it is going to decrease the blood pressure. So if we give alpha 1 agonist, then this diastolic blood pressure will increase, and this beta 2 receptor are going to dilate the blood vessel. So if we give beta 2, then this diastolic blood pressure will decrease. Now if we give the beta 1 receptor, what will happen, heart rate and contractility of heart will increase. So cardiac output is going to be increased, then this volume of blood will going to increase, and it will cause the increase in systolic blood pressure. So we have also learned the drugs that is going to affect the systolic blood pressure and diastolic blood pressure. Now resistance vessel. So resistance vessels are arterioles, and what will happen, that it has a very high amount of smooth vessel, and we have seen they are muscular vessels. So smooth muscle will be very high, plus also sympathetic supply will be high. So if they are going to be contract, then what will happen, the peripheral vascular resistance will increase, as we have learned here that if the contraction or dilatation happen, what will happen, the peripheral vascular resistance is going to be increase, and what will happen, the flow will be decrease. Now the exchange vessels, that are capillaries. So they are single line endothelium only, no smooth muscle, no sympathetic supply, nothing.